Okay, we're going to talk a little bit about where data comes from, sampling and study design. So most of what we do in this course consists of analyzing data that we're just given, getting data to tell us the story. But how do we get the data in the first place? There are whole courses in research methods and study design, but we're just going to introduce a few of the most basics of the subject to talk about in an intro statistics course. So we start with a research question looking for cause and effect or relationships. Is there a relationship between alcohol consumption and grades? Or does smoking increase the risk of heart attacks? So we have a question involving the relationship often between two variables, whether there's one is causes the other, whether they're related. And we want to get some data to answer that question. Well, we need to collect and analyze data, and there are two major kinds of studies, observational studies and experiments. We want to understand what they each are and the differences between them. In an observational study, we simply observe the variables of interest and record the results, maybe by surveying subjects or examining medical records or just watching. But the important thing is that the researcher doesn't intervene in any way. The researcher doesn't affect any of the variables. All the researcher does is observe and record. So students are surveyed about their study and lifestyle habits to see if students who consume alcohol regularly have lower grades. Just collecting and analyzing data, but does nothing to affect student behavior. Or a researcher collects data from intersections with traffic lights and intersections with stop signs only to see what kind of relationship there is between the means of traffic control and accident rate. So it's important to recognize that we'll often talk about subjects in our studies, but they don't have to be people or animals. We can study anything. In an experiment, on the other hand, the researcher imposes a treatment on the subject by manipulating one or more of the variables. And treatment sounds medical, but it doesn't have to be. It's just whatever variable manipulation you do. And observes the results after imposing a treatment, often comparing two or more treatment groups to each other or comparing a treatment to a control group. And in a randomized experiment, subjects are randomly assigned to a treatment group. So to see if a new drug lowers blood pressure, 1,000 volunteers with high blood pressure recruited and randomly assigned to take the new drug or placebo for 6 weeks. And then each subject's blood pressure is measured before and after the 6-week period. And you can see you just couldn't do an experiment to see if alcohol consumption led to lower grades. You can't randomly assign students to drink alcohol. Another example, a researcher collects data on traffic accidents in an intersection with only a stop sign and then replaces the stop sign with the traffic light and gathers data for the next 6 months. So instead of looking at intersections that either already have a light or already have a stop sign and just watching what happens at those intersections, you impose a treatment, see what happens when you go from traffic light to stop sign or stop sign to traffic light. So what we're worried about when we're doing these studies is confounding. We've said over and over again before in this class that association does not imply causation, and this is what confounding is all about. So children with bigger feet perform better on math tests because they're older, they're in a higher grade, so they've had more math. It's not evidence of cause and effect. Or suppose a study would have showed that students who are regular binge drinkers have lower grades than those who are not. Well, that may not be evidence of cause and effect either. Maybe the drinking is leading to the lower grades, maybe the lower grades is leading to the drinking, or maybe both of them are caused by outside variables like depression or family troubles. So a confounding variable, sometimes it's called a lurking variable, is one that affects the response variable, the thing you're trying to explain, and is related to the explanatory variable. And the possibility of confounding variables needs to always be considered in observational studies. When you observe an association, you have to worry about confounding. Not so with randomized experiments because the subjects were randomly placed into their groups. So there's no particular reason to think that confounding variables are going to play a role. The only difference between the groups is the treatment. So in designing experiments, it's crucial to avoid confounding. Placebos allow you to control for the placebo effect, and blinding or double blinding allows you to control for other biases. So blinding means that the participants don't know whether they're getting the treatment or the control. Double blinding means that the researchers don't know. So you might have a drug study in which doctors are giving out pills to patients, and the doctors don't know whether their patients are getting the placebo or the drug. So the three principles of good experimental design: randomly assign your subjects to groups, have a control group, and have a sufficiently large sample size. If any one of those are missing, then you may end up with an imperfect or useless study. So there's lots of different kinds of experimental designs. One kind is called matched pair, where, for example, you are your own control group, or you're your own control person. So you take a placebo for 6 weeks, followed by a drug for 6 weeks, or you don't know what order you're doing it in. And so it lets you compare yourself to yourself. Or then there's block design. Suppose you're trying to gauge the effect of calcium on strength. Well, you don't want to be comparing 25-year-olds to 60-year-olds, so you might do it in different blocks. And also the results might differ depending on the block. Maybe calcium has more effect on younger people than older people, or vice versa. Okay, there are a number of kinds of observational studies. So a retrospective study takes data from the past, and that can be very convenient because you can get a whole bunch of data all at once. In a prospective study, researchers choose their subjects and follow them into the future. Prospective studies may generate better and cleaner data because you can gather it as it's happening rather than relying on records or on memory. On the other hand, subjects sometimes act differently if they know they're being observed. Observational studies versus experiments. Well, sometimes an experiment is unethical or impossible. You can't do an experiment to see if cigarette smoking leads to lung cancer or binge drinking increases the risk of dropping out. Observational studies are harder to control for confounding variables, but they do study subjects in a more natural setting. So, pros and cons of observational studies. Observing subjects in a natural setting. This is called ecological validity. You may be able to access many years of data without waiting many years for it. And you can conduct studies which would not be ethical to do by experiment. Does illegal drug use cause students to flunk out of school? Can't do an experiment. On the other hand, with observational studies, you can't control for confounding variables. You can't specify levels of a desired treatment, and you can't determine cause and effect with certainty. It can be indicative, but it's just not as good as a randomized controlled experiment. Experiments, you can control for confounding variables. You can compare multiple specific treatments or treatment levels in one experiment, so different levels of a drug. And experiments give strong evidence of cause and effect. The cons, some desired studies might be unethical or impractical due to time constraints. And again, questions about doing things in a lab as opposed to a natural setting. Imagine psychological experiments where you're trying to learn about dating habits. It's pretty hard to set up something in a lab and say, okay, you people flirt with each other or date. That would be hard. So some things to watch out for. Always worry about confounding variables, and don't be too quick to imply causation from an observational study. You should worry about extending results inappropriately. If you do a study on college students, then you have to wonder whether it's applicable to people in their 50s or 60s. You have to worry about variables interacting with each other. You should be concerned about what's called the Hawthorne effect or other experimenter effects. The Hawthorne effect is when subjects act differently knowing that they're being observed. And you need to worry about ecological validity and how generalizable your data is. And using the past as a source of data makes it hard to get good data, and maybe the conditions no longer apply. Okay, and next we'll take up sampling.